A migraine is a type of headache that has resulted in specific changes within the brain. It causes severe head pain that is often accompanied by sensitivity to light, sound or smells. To learn more about the symptoms and also how to treat this condition, we consulted Dr. Suhail Al-Rukn, neurologist and head of the stroke unit at Rashid Hospital.
Doctor, what are the causes of migraine and how to avoid it?
Migraine is type of a headache which we call it primary type of headache. There's no pathology, there's no tumor, nothing in the brain to cause this type of headache. To define a migraine, there's 5 criteria for the migraine. These criteria including a moderate to severe headache. Usually the migraine is unilateral, one side, right or left, and it can shift between the side. The third thing, it should stay between 4 hours to 72 hours. And it can associated with nausea, vomiting, or with the photophobia and phonophobia, where the patient during the headache, she or he doesn't like to talk, neither like to have a direct light on their face or to have a noise like a TV or children around them. This type of headache, some people can manage it with a paracetamol or with one tablet or brufen, or to have a nap and sleep. But many patients, they will have a severe headache that can impair their quality of life. How frequent someone can get the migraine headache? It can be from once a month, once every 2 months, and few of my patients, they had that every week, 1 or 2 times. So that's too much to have headache that frequent. There's certain type of headache coming with the ladies, the migraine, which is before or during their monthly cycle. The question is, how can we deal with the migraine, Dr. Suhail? Number 1 is, you should have a good sleep, rest at night, at least 6 to 7 hours. We found in many international studies, sleep deprivation, not sleeping good, will cause migraine attack. Second thing is having good breakfast. People who's having a migraine with a drop in their blood sugar during the daytime, because they didn't have a good breakfast, they will have more headache or a migraine. Number 3, stress. We found that with the student, with the people who's running a business or office work and they're under stress, they will have more of these migraine. So these are few things that the patients or the migrainous patients can avoid stress, good sleep, have a good breakfast. So what's the part of the physician? First one is to diagnose the headache. It's a migraine headache. Second thing, we have a medication that we call it for acute migraine attack, which we call it the acute therapy, and there's the preventive therapy. The acute therapy, there's different medication starting from paracetamol to brufen to naproxen and other medication which can stop the acute attack. There's another type of medication that we call them preventive migraine medication, and there's a huge family from antidepressant, anti-epileptic, some of the steroidal medication that we can use them, which can prevent the migraine from happening and the attack. The last thing I would like to mention here, migraine can run in a family, where we found in many studies that between 40 to 50% of a migrainous patients, they have a family history of migraine.